Diabetes is a widespread health concern affecting millions worldwide. It can lead to various complications, and one serious one is diabetic retinopathy. This condition affects the eyes and can lead to vision loss if left unmanaged. Understanding diabetic retinopathy is crucial for those with diabetes. Early detection and proper management are essential in preserving vision. Diabetic retinopathy. It occurs when high blood sugar levels damage the tiny blood vessels in the retina. The retina is a light-sensitive layer at the back of the eye. It captures images and sends them to the brain through the optic nerve, enabling us to see. High blood sugar can weaken and damage these delicate blood vessels. This damage can cause them to leak fluid or bleed. In some cases, new abnormal blood vessels may grow on the surface of the retina. These changes can interfere with the retina's ability to function properly, leading to vision problems. Diabetic retinopathy usually affects both eyes. It is essential to understand that early-stage diabetic retinopathy may not cause noticeable symptoms. The primary cause of diabetic retinopathy is prolonged high blood sugar levels due to diabetes. When blood sugar remains high for extended periods, it damages the blood vessels throughout the body, including those in the retina. Over time, this damage weakens the blood vessel walls, making them more susceptible to leakage and bleeding. Additionally, the damaged blood vessels may not supply enough oxygen and nutrients to the retina. This can trigger the growth of new abnormal blood vessels, a process called neovascularization. These abnormal vessels are fragile and prone to bleeding, further damaging the retina. Diabetic retinopathy typically progresses through different stages, each characterized by increasing severity of retinal damage. Understanding these stages is essential for determining appropriate treatment strategies. Mild non-proliferative retinopathy, NPDR. This is the earliest stage, characterized by microaneurysms, tiny bulges in the retinal blood vessels. Moderate non-proliferative retinopathy, NPDR. As the condition progresses, more microaneurysms develop, and some blood vessels may become blocked, reducing blood flow to the retina. Severe non-proliferative retinopathy, NPDR. At this stage, many more blood vessels are blocked, depriving the retina of blood supply and causing the growth of new abnormal blood vessels. Proliferative diabetic retinopathy, PDR. This is the most advanced stage where new fragile blood vessels grow on the surface of the retina. It's important to note that diabetic retinopathy can progress at different rates in each eye. Recognizing the symptoms. In the early stages, diabetic retinopathy often doesn't cause noticeable symptoms. This is why regular eye exams are vital, especially for individuals with diabetes. However, as the condition progresses, individuals may experience various vision problems. One common symptom is blurred vision. This blurring can occur if the macula, the central part of the retina responsible for sharp central vision, is affected by fluid leakage or swelling. Individuals may also notice dark spots or floaters in their vision. These floaters are caused by blood or other fluids leaking into the vitreous, the gel-like substance that fills the eye. As diabetic retinopathy advances, individuals may experience fluctuating vision, where their vision changes throughout the day or from day to day. In severe cases, diabetic retinopathy can lead to vision loss. This vision loss can be partial or complete and may affect one or both eyes. Diagnosis and treatment options. Diagnosing diabetic retinopathy involves a comprehensive eye exam. The pupils are dilated to get a better view of the retina. The retina is examined for abnormalities like microaneurysms or bleeding. Treatment aims to slow progression and preserve vision. Options include laser treatment, injections, and surgery. Prevention and management. Preventing diabetic retinopathy involves managing blood sugar levels, following a healthy diet, regular physical activity, and taking prescribed medications. Regular eye exams are crucial for early detection. Early treatment can reduce the risk of vision loss.